Hi there. Thank you for your patience. Had a little bit of technical difficulty this afternoon, but thank you very much for joining us. This is Bart Walker. I'm a partner with McGuireWoods in our healthcare group. I'm joined by another one of my partners, Anna Timmerman, who practices out of our Chicago office, also in the healthcare group. We're just delighted to have you all here today. I know we've got quite a number of folks who've signed up. This is a topic of interest to a lot of folks. This is a conversation with two of the great leaders in the dental industry today, in particular DSOs. We've got Andrew Smith, who is the new executive director for the ADSO, and we also have the organization's president, Emmet Scott, who himself is the CEO of a substantial DSO, one of the leading ones in the country. We're just delighted to have him here with us today. What we'd like to do, we'd be delighted to answer some questions along the way from the audience. There is a Q&A tab where you can submit questions as we go forward. Both Anna and I have prepared some questions to help spark conversation here, and can't wait to hear what Emmet and Andrew have to say about it. But let's just start off, I guess, Andrew, if you wouldn't mind just giving a brief introduction of yourself and your background, and then Emmet, we'll go to you, and then we'll very quickly just jump into the first question.
Great. Thank you. It's great to be here, and thank you for including us. Also, as many folks may or may not know, I'm a former McGuireWoods consulting alumni, so it's great to be back with McGuireWoods. So just a very quick background. I spent about 15 years in public practice, either on campaigns or in government services, and when I decided to switch over to the private side, I was honored to join McGuireWoods Consulting in their Washington office, where I focused on state and federal government relations issues for companies that were highly regulated at both of those levels. And then I jumped over to work for a client of ours at McGuireWoods, a cannabis company called Parallel, where I led their government relations and kind of built out their footprint, so to speak, in multiple states across multiple modes in government relations and communications, and then decided to make the switch over into the trade association world. And Emmet and I have been working together for about 6 weeks now, and it's been very exciting, and I'm glad we're hitting the ground running.
Great. My name's Emmet Scott. I'm so thrilled to have Andrew Smith on the ADSO team. I got into dental a little over 10 years now. My best friend from the age of 2 is a dentist, and he wanted help opening his first practice. And we ended up building something that was a really unique experience for kids. And, I won't go into all of it, but they get gold coins, and it's a movie theater, play gym, and it's designed as a storybook. And so we were really like customer, patient focused, and it just took off. And so we built out more of these dental practices. I didn't know what a DSO was, and I started hearing about it and pros and cons, and so I started a podcast called DSO Secrets, partly to get feedback from people, and then I ended up getting involved with DEO, the Dentist Entrepreneur Organization, and then last year was asked to be president of ADSO, and so now I'm fully in, Bart, and I love the industry. We support over 70 locations. We're currently looking at over 200 practices that are interested in some level of being on our platform. So I'm out in the space at every level right now, and I just love what dentistry, I love the mission of dentistry. It's so much bigger than just a simple dental practice and what impact it's having in communities.
Well, you both certainly bring a tremendous amount of enthusiasm and energy to the space, and it's been really fun to see the success you guys have had, and wish you the best going forward. We'll go ahead and just jump into the questions here, and again, welcome audience questions as well. But let's just kick it off with, I think, the biggest topic on everyone's mind just over the last, call it 12, 13 months, which was the COVID-19 pandemic. Give us some insight on how the ADSO and your members have weathered that storm, and in particular, if you can think of a couple of examples of ADSO members really going above and beyond the call of duty to serve their communities and patients, that'd be really helpful. I mean, we've anecdotally heard a number of those stories over the last 12 months, and we'd just love to hear your input on those points.
Emmet, you want to take that one?
Sure. Yeah, we didn't really coordinate on who would go first on this stuff, so we'll just kind of do handoffs. So at an ADSO level, there was, for the first time in dentistry, 95% unemployment, if you will, for the month of April. Like it never happened. People don't go and, have $500,000 in student loans because they think they're going to be 95% unemployment rate. So this was brand new for this industry. And then the complexities were insane. So ADSO was very involved in things like the PPP and the HHS grants to ensure that dentists were recognized either as small business and also as healthcare. So I think one of the things that became critical at the ADSO level was there was this almost pushing aside of dentistry, and it was a time for us to push back and say, no, dentistry is critical, essential healthcare. And I think that momentum is something that we are seeing best. And we can talk about this more later in some of your other questions. But I think that's been a big response at the ADSO level is we've got to have dentistry not just a seat at the table, and we can talk more about this, but I think it should be at the head of the table when it comes to healthcare. At a DSO level, when I look at our members, never had dentists had as much complexity when it came to PPP, PPE, safety, all of these things that were coming so fast and furious, executive orders, legal. And so, dentists who were on their own trying to navigate this, it was very overwhelming. And what we noticed with our DSOs is they really stepped into being dental support organizations, right? They provided platforms for the clinicians to figure out what they wanted to do clinically. And then they were taking all the noise off of these docs, saying, hey, we'll take care of the PPP stuff. We'll help with procurement of PPE. And I think the big one is with those resources, they were ensuring a level of access in alignment with clinical for the patients and really got focused on, okay, we understand that there's some initiatives to have us push to the side. We also feel a lot of passion that these patients should not be going into the emergency room. So anyway, I feel like that really bonded a lot of our mission and focus.
Great, thank you.
Andrew, I don't know if there's anything you want to add to that or Bart. I'll throw in one other thing is one of the things that we ended up initiating was a new position called a health and safety expert. So, this was a new thing for businesses to now have someone, with wifey cloths and sterilization and so forth on a regular cadence and making sure people were wearing masks. Now you've got call centers and support centers that needed to go digital. So working in teams going remote. So how do you, move them to remote? So again, there was a lot of focus to keep safety a high priority for patients and for staff.
Yeah, and I think, to Emmet's point on that, I think the pandemic, at least what I have seen, from my time coming over to ADSO is a strong, ability to work with OSHA on the federal level, especially to make sure that, our clinicians feel, safe in the workplace as well as our patients, because as Emmet loves to say, and our message really is, we support our dentists and we support patient, access and care. And so what we've seen is a greater involvement of not only working with our state partners, but also the federal government in many respects. And I think we'll continue to see that moving forward post-COVID.
Okay, and just so you guys know, we have a question that came in asking whether dentists have kind of generally come back to their pre-COVID revenue levels and kind of how long that happened. I don't know if either of you have gotten that kind of feedback. Yeah,
so it's interesting, and I have to give credit to HBI for doing a lot of the data and around this over at ADA, and we've worked closely with them with our own data. And we also worked with Strawman Group, who looked at Europe and China and just overall rebounding, if you will. I would say that in general, American-based dentists have done better than some of the foreign situations as far as rebounding within the healthcare space and back to pre-COVID levels. And the DSO supported dentists have done much better than those dentists on their own. Now I'm speaking kind of globally, not individually. There could be a dentist who's just doing amazing and rebounded great, but I have to attribute that to just the complexity that these individual dentists have had to work through. What we see in the data right now is most dentists are back to that 70, 80% level, where what we saw with DSOs, it was almost like a V. There was a very quick rebound. The clinicians were ready to support. I think there was generally more confidence of staff because they had the appropriate PPE. Communication platforms in general were propped up very quickly, and so there was a lot of communication going out. So, but yeah, when we look at the data, the DSO supported dentists have come back much faster, probably by about 15-20% difference.
Wow, that is awesome. And you know, I think that we've definitely seen that even just in our practice too, Bart and I, because you know there really hasn't been that much of a dip even in the transaction space, and I think that really is attributed to how quickly the dental community was able to rebound. And you know, kind of sticking with this same topic, you know, as we, fingers crossed, are kind of coming out of the worst of COVID, you know, what's the biggest challenge then that your members are facing today? And how is ADSO taking the steps that are necessary to help them address that challenge?
Yeah, you want me to start with that, Andrew, or you want to go ahead?
Yeah, I was just you go ahead and start. I had a thought after you.
So number one is just generally with staffing, and part of it is just, I think, across every industry. Our industry, though, healthcare in general, is very dependent upon women in the workforce. And I think women are dealing with more complexity than anyone right now through all of this. I know, you know, having 6 kids myself, we're having school, we're not having school, we're having school, we're not having school. It's just, it's insane, and it's difficult to navigate. And then all of the health components, maybe having individuals who are, you know, grandparents who are taking care of kids, et cetera. So that's something at a very DSO practice level that I think the industry has been facing. I think also it's been exposing of where we need to step up in health integration, where we need to step up in technology. You know, we know in like Texas, for example, the dental board here was very aggressive in saying, you know, no teledental shall be done during this pandemic. And that feels a little tone deaf to a global pandemic when you're trying to access patients. And so I think there's a lot of interest in the space and for our members to really upgrade dentistry into the 21st century to provide better convenience for patients.
Yeah, and I think, you know, some of the challenges, I can speak a little more on the, you know, kind of government relation, you know, side of things is, you know, I think it's actually a lot of opportunities for us. You know, I think, you know, for example, you know, we're working on some legislation in Texas, you know, supporting teledentistry. And, you know, I think a lot of folks recognize, you know, that because of the pandemic, you know, the traditional means of care can be changing, especially with the technology that our member companies are able to provide from artificial intelligence and elsewhere, that you can do a lot of those things. And we've been very blessed with seeing that, some of the associations that may have been adverse to some of those positions, 9 months ago, a year ago, are changing their thought process and are actually supporting that. So I think there's actually quite a bit of, I would turn it around and say, out of the crisis and the pandemic, there have been unique opportunities for our businesses to grow and for patients to get better access and care. So that's one way, that we're really looking at it, and that I'm looking at it, is it from a strategic point of view of how we can provide, more care and greater care.
Well, I think that's a great segue, Andrew, into what we're going to dive into next, which is what do you see on the legislative and regulatory front? I know you guys have been particularly active in advocating for the interests of dentists and DSOs at the state and federal level. Where do you see your priorities, and what are some of the key things you guys are focused on over the next few years?
Sure, I'll start off on this one. So I think there's a lot of things that I think you're going to see ADSO continue to lead on, and I think one of the strategic focuses of our organization will be one of those leading voices when it comes to legislative and regulatory issues moving forward. So a couple things that are coming down, in our mind. I think figuring out there's always going to be some states that have, some adverse aspects and historically adverse aspects to the quote DSO model. I think we're at an inflection point here where the DSO industry is not having those types as much of those existential threats, if you will. There will always exist, certainly, but I think we're in a unique position, as I was touching a little earlier on, of moving the needle further about, how dentistry can be, continue to be elevated to a higher level. And we're going through a strategic process right now of some strategic themes we're thinking about and how we can incorporate those into government relations. So, how do we continue to tell the narrative around the oral body connection? How can we make sure that dentistry is still continue to seem and be an essential service regardless of COVID? How do we elevate it to the same level as physician care? How do we provide greater access? So I think you're going to see the DSOs, particularly ADSO, leading around those issues, both at the state and federal level. I think, we're going to be telling those narratives in a whole host of states, especially in states where we continue to grow. But I also think you're going to see, the industry is moving towards that model, and certainly, external stakeholders and the policymakers and dental boards are seeing that, and there are going to be greater collaboration with folks such as the ADA as well as, the Dental Board Association. So those are a couple, kind of core areas that we're really looking to build on over the next couple of years.
Yeah, here's the thing that I think COVID really put a highlight on. Dentistry was not respected in healthcare nearly at the level it should be. We're talking about the largest set of healthcare providers who proactively see patients on a consistent basis more than any other healthcare provider. One of the things dentistry has done really well is ensure that patients, the best they can, come in on a regular basis. Now, ideally every 6 months, but they built into their model to be proactive towards preventative care. And I would argue better than any other healthcare provider out there. And this is why I say I don't think dentistry should just have a seat at the table. I think it needs to be at the head of the table and start educating healthcare on how to be proactive in preventative care. And when you look at the way that we responded to a global pandemic, where we said, hey, these healthcare providers who can absolutely give COVID testing, who could absolutely give a vaccine, are 20 years behind legislatively to be able to do these things, we really don't have anyone to blame but ourselves. And I have to say that part of our initiative is we have to get aligned as an industry, because we've been squabbling over silly things like, should dentists be able to have CFOs and COOs or not, right? And I think that discussion is over. The alignment that we're seeing with the other associations is awesome. We're getting great acceleration and probably more than ever working together to say, okay, whatever we thought was an issue is like minor compared to where we really need to take the industry as a whole. So I will say one of our critical points that Andrew and I are working on is we just want to build bridges and have alignment. We just had a ADSO summit, virtual summit, and it was the first time ever we had the ADA president, we had the Georgia Dental Association president, we had the president of the dental boards on there, and everyone's on the same page. Like, dentistry needs to work together to help change healthcare generally. So I think we're going to be very supportive of this. Andrew mentioned this legislation in Texas. We're doing it with the Texas Dental Association. So those type of things are going to be the future of ADSO for sure.
That's terrific. That's a level of coordination and cooperation that we've not seen before, and obviously that's terrific. Do you have a sense for, and I don't know the answer to this question, or if you know it, so this might not be fair, but do you know how that compares to other countries and how it's done? Like, is the U.S. just lagging behind everyone else in this, or is this something that is more on the leading edge where we're actually innovating ahead of the curve?
Yeah, the good and bad and I was a little surprised by this, but the pandemic did allow for a high level of coordination globally for the first time with other associations and groups in other countries. And sadly, human nature is human nature. So in those other countries, there was a lot of concern around change and dentistry as well. So we are absolutely ahead. We're leading the pack as far as innovation, as far as alignment within the industry. So as disappointed as I am where we are today versus where we're going, which I'm very excited about, we're ahead of other countries globally. And they're actually looking to us on how we're solving this, and I think they'll follow our lead.
Good. That's great to hear.
Where I would say that they're probably a little bit ahead of us, Bart, is because a lot of them have already integrated national and socialized medicine. There's parts of their dentistry that are more integrated in with healthcare along those lines. And so that's something that we have to still take on. And I think there's a little bit more alignment in ensuring that payments to dentists are appropriate. And I think that's something that we have to take on. I think a big beneficiary of some of the misalignment has been that insurance rates have not gone up in 10 years or more for dentists. And so insurance companies, we've got to get better alignment with them if we're going to innovate, if we're going to provide higher and higher quality of care. Because if they're going to hold the checkbook on these things, they've got to be aligned that this is what we're trying to achieve with patient care.
It's clear that education costs and technology costs and capital expenditures, like none of that's getting any cheaper either on the provider side. So it just makes sense that there would have to be some kind of accommodation there, or innovation in terms of payment models and risk sharing. I mean, that's another piece that
there was some
talked about. Yeah.
There were some really big misalignments that happened during COVID. Again, they exposed, when insurance companies are saying things like, yeah, we're not going to pay for PPE. You should have calculated that into the, it's like, no, global pandemics are not calculated in, right? When patients aren't coming in, but insurance companies are still collecting premiums, but not helping cover anything for providers. Things like this have to get solved for the industry to move forward. So, and to your point on adjudication of claims and so forth, the insurance companies are going to have to make bigger investments in technology than they have, because a lot of the operating systems they're working off of are not 21st century level.
Yeah, and I think Bart, to Emmett's point, there's been a big discussion point within the membership at ADSO of, is there a role for us to play in that debate, on the insurance side, and I think you're going to see, potentially, maybe some involvement there. Obviously, it's at the discretion of our core leadership. But I think it comes back to that point of the ADSO wanting to be a leader and thought leader in this space, and I think you're going to see us continue to have those dialogues and conversations and potential advocacy where we think we can fit in.
And Andrew and Emmett, kind of touching off of that, because we've talked a little bit, even already about the alignment both within the industry and with payers and building bridges. And so, you're both relatively new to your positions. And then I think you started in July, and Andrew, you joined in March. And so, have you all been kind of working on what your collective vision is for ADSO in the year ahead? Is it, I imagine that, COVID kind of changed things for everyone, but, is it really about the alignment, or where do you see ADSO kind of going this year?
Yeah, great question. And so, kind of is actually a perfect timing, because we're currently undergoing a strategic review and strategic planning session a couple months from now, where I've had the opportunity to speak with all of our executive committee members. That is a wide range of our membership to kind of seek their input on a whole host of issues. But I think the core of what I've been hearing is that the membership wants ADSO to be the premier advocacy and resource center for dentistry. And I think, how we tackle those issues of government relations at the state and federal level will be key. I think how we communicate to various audiences, from, kind of external stakeholders, the general public, the healthcare and dental industry, as well as our own membership, will be a component of that. I think you're also going to see, how we do events for our membership, for the public, for stakeholders, where we really want to be the leading driver on policy content, on advocacy-related issues in the dental space, on where things are moving, and plus, how do we be, as we both mentioned, how are we better aligned with groups in this sector? So, it's still, kind of forthcoming and being developed with the goal of implementing over the summer, and then we will be doing a fall event, most likely in person, with a lot of our, CEOs as well as industry partners, where we'll be rolling a lot of that out with the goal of having, that premier type event that we'd want to do on a yearly basis next spring. So, I think, there's going to be a lot of exciting times for us to be in this space.
Yeah, it's fun because, I've been in the DSO world for 11 years now, and a member at ADSO for a while, and got to watch the evolution. But we definitely went through a wormhole as an industry, right? And I think a lot of industries did, of having to go to the next level. Amazon, if you will, was kind of already laying the groundwork that the world was changing. We all became much more entitled in how we want delivery of everything in our life, and healthcare isn't any different. So I think Andrew and I are in a unique and fun position that really the ADSO of the past isn't what we need for the future. Not all of it should be thrown out, but there's a lot that the industry is ready for. And as we've talked to other associations, they've changed too. The ADA of the past is not the ADA of the future. The Hygiene Association of the past is not the Hygiene Association of the future. All of the dental boards of the past are not the dental boards of the future. So all of us are really regrouping, and it's pretty exciting, because it's almost like we just get to hit the whiteboard and say, all right, what do we want this industry to look like? Because one thing that's really clear to me is we were able, as a healthcare industry, to rely on the fact that we were a need, right? That the consumers needed us, and they didn't have a lot of other distractions. Well, since the invention of the internet, and in 1995, and then 2007, we have this iPhone come out, right? It's very clear I have a lot of distractions in my life. And I could sit on this phone and buy something here and watch this and do this. Healthcare and other need-based industries are going to have to step up, because the want side of our life have been weaponized now with marketing and social media capabilities and convenience that we've been a little more flat-footed in. You know, I think in Texas up until 1980s, it was illegal, and I think this is in most states, it was illegal to market dentistry, right? If your name was bigger than 2 inches, the dental board was coming out to you, right? So we lived in a different world there. Today, I think we'd all argue that if you're not doing marketing, you're actually not promoting the industry appropriately. You're actually allowing consumers to get distracted by things that aren't as important as oral health care. So again, the whole world's changed. It's been changing, it's been evolving, but COVID's been just this great accelerator. So I'm excited to kind of be in this new era together with Andrew and with the other association leaders.
Absolutely. Also, Andrew, you mentioned something a second ago that I guess I hadn't really thought about too much until now, which is, you know, making the ADSO, you know, kind of known to the general public. And how much of what you guys are looking at now is, you know, kind of making the general public a little bit more aware of, you know, what dental practices that are using DSO services can actually do, or you know, just generally, because I just think generally the public isn't particularly even aware, perhaps, that this kind of arrangement or level of service kind of exists, maybe behind the scenes.
Yeah. Yes. So I mean, I think part of that is talking about, you know, what the ADSO is doing from a advocacy point of view to make healthcare not only more affordable, but better access and better care generally. So I think you'll start to see, you know, that component, you know, over the next, you know, couple months and definitely down the road of us kind of helping showcase that content and that capabilities and what dentistry is doing. I think that's an important, you know, component because it's going to touch on, you know, numerous segments that I mentioned, including kind of the public. So that is definitely going to be a focus area for us.
Yeah, I don't think that, you know, if you're taking the term public and all the way down to like patients, I don't know that that's, you know, a current initiative. I think, Andrew, as you're thinking about public, right, it's regulatory, legislator, and dentists generally really understanding our role to support. I think if we're doing our job well, then the dentists are looking like superstars, right? It's just, I think at the patient level, they're saying, I don't know what the difference is, but this dental practice really has its stuff together. The technology's there, the staff are well trained, the doctor has the support that they need, right? So I don't know that our intention, and I don't know if this is where you were going with that question, but I don't know that our intention will be like, we need to have our DSO name front and center. I don't think that that's what we need in order to make this industry successful. We need our dentists to be as successful as possible. That's our customer. So that's for us, the public.
Correct. That's a great clarifying point. And yes, I think the more that policymakers understand these issues, and as well as the industry understands the issues and how we're helping move that forward, the better the association and better our membership.
So this is Bart. I wanted to circle back on something that you sort of alluded to earlier, which was the evolution of dentistry beyond its traditional boundaries and, you know, really positioning dental providers as true primary care providers in the sense that you have kind of oral-centered care and care that's expanding beyond the traditional boundaries, and which, quite frankly, fills a pretty significant need in a lot of different populations. For example, just a simple fact that most people who have dental coverage of some shape or form see their dentist at least a couple of times a year, where they typically only see their primary care doctor once a year, if that. What are you seeing in terms of evolving models, and what is the ADSO doing in that regard on some of those more sort of avant-garde models?
Yeah, let me hit on that point. That first point even deeper is, when was the last time your primary care doctor called you and said, "Hey, Bart, we did your blood work 6 months ago. Love to have you come in again so we can really start benchmarking where you're at," right? It's a disappointment to me that we're not more proactive, preventative, proactive in healthcare. And this is where I think dentistry can start to lead, because we want, as consumers, for businesses to be reaching out to us, to be creating that level of convenience. And I think where ADSO is going to continue to support DSOs as they're supporting clinicians is, dentists have their biggest competitor right now is the Amazon convenience of the world. It's this cognitive dissonance that, man, that's so hard to set an appointment. I have to make a phone call. I'm going to have to call them back. Anything that's a barrier to entry, and, let's be honest here, we're not giving out iPhones. Dentistry is not always the most exciting experience, right? I mean, it's great to get the whitenings, it's great to get the ortho and the straightening and so forth. But when it comes to like some of that deeper care that's needed, sometimes that's not exciting. So we're going to naturally, as consumers, want to avoid that anyway. I think we've got to realize that the world is very entitled around convenience, and we've got to be bringing in everything, every resource we can to our DSOs around technology and patient convenience communication that's available in order to move this industry to the next level. As proud as I am about what we're doing, we still only have a penetration rate, market penetration rate of somewhere around 40%, right? So cell phones are at 120%. I don't think we're going to get to 120%, where people are like, I want to come in every 3 months instead of 6 months, but I'd love if we did. But I think we could get from 40% to 80% of active patients. And if we do that, we double the entire industry. And I think that's part of what we want to drive as far as vision with alignment is, instead of pretending like dentistry is a scarcity model where we've already done everything we need to do to have market penetration, instead realize that there's a lot of work for us to do. And if we do it right, we actually could double the industry for everyone and start saying, we just need more dentists to be able to provide all of this care. So anyway, I don't know if that fully answers your question, but that's where my passion is.
Yeah, no, it sounds like it. And one follow-up question on that, how do you operationally achieve that? Is that in expanding the scope of practice of dentists? Is that in more of a true multidisciplinary model where you'd also have, I don't know, nurse practitioners, advanced practice nurses, even physicians really housed underneath the same roof?
Yeah, what's exciting in the DSO model is we get to explore all of those things, right? What's problematic for an individual dentist is they can absolutely, get trainings around certain clinical procedures and have an impact kind of locally. But with DSOs, if we have DSOs who are very excited and interested in being able to provide more diagnostic care, to be able to do A1C testing, to be able to do cholesterol panels, to be able to provide vaccines. We now have DSO-supported dentists doing vaccines in North Carolina and several other states. So this is what I think is great about the entrepreneurial level of support that clinicians are getting from DSOs, is those who say, hey, I think there's an opportunity. We have a large DSO who's working closely with the Cleveland Clinic, and they're saying, all right, how do we integrate our handoffs better? Because where dentistry is outrunning the rest of healthcare is we're just seeing the patients more often. So to your point, Bart, like, what should we be doing with that? If you're a heart surgeon, you're just not seeing the patient as frequently as a dentist. And frankly, if you're a primary care physician, you're not seeing them as frequently. So how could we be doing handoffs to primary care? We have DSOs who are now integrating new practice management software that integrates with larger healthcare so that those handoffs are easier, and they're starting to bring in nurse practitioners and doctors to have a more holistic visit. So I'm actually really excited as each of them explore different paths based on what their clinicians are excited to do. Here's what I think is disappointing, though, Bart, is that you don't, what we don't have, and I hope this changes over, fairly rapidly, is when you have a global pandemic, I hope one of the first things we say next time is, all right, well, the good news is dentists can do this testing, so let's just get it out to them because they're seeing the public more frequently and they're more proactive and they've got the technology to text them and get them in, and we can do contact tracing through dentists better than any other healthcare provider. I think all the raw material is there to make that vision come true. Or we want to roll out vaccines. You know what? Do you know who gives a lot of shots? Dentists. All right, so why don't we have them, let's get this vaccine rolled out to them as quickly as possible. We already have them doing these vaccines. So this is how I see the future. So we can get this nailed down very quickly, and they can reach out to their patients very rapidly because they've been upgrading their technology, their communication, and their convenience. And so scheduling's easy for them, et cetera. So that's where I'd like to continue to progress.
Yeah, and just to add on that.
Go ahead, Andrew.
Just to add on to that a little too, to the earlier question about the communicating that is going to be a key component for myself and my team at the membership of making sure that those external stakeholders, policymakers who make these decisions are comfortable and aware of this, and that's the opportunity COVID presents, that we are able to do all this. And it just allows for better care and more patient access ultimately. So, I think you'll see ADSO taking a very, strategic interest in a host of states, to Emmett's point of saying, how do we, how can DSOs help in that promotion of better dental care that ties into physician care and all these other things. And, I think we're going to start identifying those states that are going to be leading the way, and ADSO wants to be on the front end of that.
Yeah, I just got my second shot at CVS, which I'm very grateful that I have access to that here and that they've opened it up to everyone. But I can tell you that the individual, as trained as he might have been in giving me that shot, is not more trained than a dentist clinician giving me that shot. So why are they able to do it and dentists aren't? A lack of focus as an industry. So yeah. I think as we create that focus, then we can really expand wherever dentists want to go in healthcare.
So, gentlemen, we have a couple of other questions that have come in that I want to make sure that we get to since we're, running down on time here. So the first one is in reference to cracked teeth as a result of the stress and everything that's kind of come about from the pandemic, and whether whether the dental practices that you're aware of are seeing this, and whether there's a big backlog of deferred treatment coming, or whether somehow those volumes will be lost.
I can kind of speak to volumes generally and a little bit to what I hear from my dentists. First of all, March was our largest month ever as far as patients coming in the door. And that was generally in healthcare or in dentistry. A lot of the DSOs saw an upswing. So I think there's a level of safety with the vaccine. People are coming out more, et cetera. April is the same. But to your point, there is a lot of issues with teeth, both from the stress component and just deferred hygiene. I mean, I've always had a testimony of the importance of the hygiene cadence that we do, but having seen kind of firsthand what happens when that gets skipped on kind of large number scale, it's dramatic. And I think some of the studies around COVID response for those who are getting oral health versus not, which came out of England, was helpful too, to say there really is a oral systemic health connection here that we need to be cognizant of. So again, we now have our large study on what happens when you shut down dentistry, and it's not positive.
Yeah, absolutely. And then the other question that we have, and Andrew, maybe you want to start with this one, is that there's been considerable talk about economic bifurcation within our population. And this individual read a statistic that hiring managers will often make negative hiring decisions based on one's presentation of oral health. And so one thing that he's not heard being discussed yet is really a way to penetrate underserved populations with respect to dental care. And so looking for some thoughts around that.
Sure. No, great point. And I think one of the strongest narratives and arguments that the DSO model has is that we are very capable of serving populations, either that are underserved or rural, that, kind of quote unquote dental deserts, if you will, that we have an ability to penetrate all marketplaces, including the underserved. And, I think, a couple things. One, we talked about teledentistry. Obviously, the people don't either have, time or ability to get to the dentist's office in many respects, but might be able to do a teledentistry appointment, especially around orthodontic care, and especially, I think, to that questioner's comment about the presentation of oral care, and it's becoming more cost effective. So I think, that's certainly one aspect that many of our members and industry partners are working on. And then obviously COVID, has made it a plausible alternative, and people feeling, safer to do teledentistry and other things. So, we don't stop that process. But, again, I think it all comes back to educating, especially on the dental boards, about, hey, we have a lack of access to care and affordability in many areas. And if you've had a concern about the DSO model before, we can understand that DSOs allow for greater patient care and greater access. So one of the priorities that we have had over the past several years and will continue moving forward with is continuing to have, DSO folks, very involved with dental boards so they understand and get that, your goal is to provide good quality and safe care. And that's something that we can do and just make it all around better. So those are a couple thoughts on that topic.
Yeah, I was talking to the National Dental Association, which represents Black African American clinicians, and one of the things that I think we have a lot of alignment on is they're concerned about some of the access components, and one of them is that insurance companies reimburse differently by zip code. And it's a little bit of chicken egg, but they end up reimbursing lower in some zip codes that really we've got to normalize that. It's creating disparity, because if I'm a clinician and I'm going to get paid, 20, 30% less because I go across the street or into a certain neighborhood and service those patients, we're not doing any favors to our healthcare system that way. So that's something that we're passionate about and we've got to get solved. I think DSOs, to your point, Andrew, allow access through capital, allow also access because of the complexity with serving Medicaid populations that have so much more compliance around it. We've seen where states have blown up and had issues with OIG, et cetera. And if you don't have the legal team, if you don't have the compliance team to make sure you can handle those things, then as a dentist, you're not going to take that complexity on. And being a DSO that supports practices that see Medicaid patients, foster kids, et cetera, some of these other insurances, I can tell you it changes the trajectory of that child's life. So I don't care if you're an adult or child, we are social beings, and your mouth is a big part of how you're perceived. And when you're a child that your teeth hurt, you're going to eat softer foods, which means not vegetables. You're not going to smile as much, which the teachers are going to perceive a certain way. Interviews are going to perceive a certain way. So as soon as you can get that oral health care, everything changes for you. And we get those testimonials on a consistent basis. So this is where some of that passion starts to come in of how do we get more access to people, both on just like a basic healthcare checkup need and then some of the cosmetic components as well. Because I think it's a huge momentum to lifting some of these demographics out of their current situation.
Yeah.
Well, I think we're about running out of time here, so maybe just one last parting shot, and hopefully this will tie together a few of these different threads that we've been talking about. But so going forward, what do you see as the biggest opportunity for DSOs? I know there's plenty of fodder in the last 50 minutes, so you've got a lot to choose from, but if you could only pick one, what is the biggest opportunity in front of DSOs right now?
Yeah. Emmet, do you want to kind of start it and I can maybe...
Yeah, I'll go with alignment. You know, I mean, a house divided, we just can't execute well. The amount of money spent internally fighting over silly things, in my opinion, is not money well spent. So if there was one place that I'm most excited about, it's the alignment, because all of those dollars now get to focus on moving the industry forward. So I'm most passionate about that. I feel like everything else is a domino effect from alignment. When you have NDA, the dental boards, ADA, ADSO, all working together, and Admiral Tim Ricks has done a great job of having a cadence where we're all attending, and I think there's 30 different dental associations on there, from research to provider support, et cetera. When you get that kind of alignment happening, and again, we have to thank COVID for driving that, there's not a lot you can't do. So I'm most excited about that.
Yeah, no, I mean, I couldn't agree more with Emmet on the alignment front. I think, you know, probably the great, I'm going to look at this from an ADSO point of view that benefits, obviously, you know, DSO and dental largely, but I really think that one of the great opportunities facing us is, and coming out of COVID, is the narrative and message that we have to tell about dental and kind of all the exciting things we're doing. We've kind of touched on all those points today, and I think the opportunity to share that message with the full audiences we've talked about is going to be a huge, huge opportunity. I mean, you know, the DSO model is very entrepreneurial, very, you know, thought caring on the access of care issue, and I think that's an important message to carry forward to a whole host of audiences, particularly on the regulatory side. So I think if we're able to have that alignment and be able to deliver those messages and strategic initiative narratives, you know, the world is our oyster in terms of how we're going to be able to provide care and greater care.
Terrific. I think that's an excellent summation of this conversation. I think we're ending right on time here. I just want to thank you guys for spending the time with us. I mean, this is always an education anytime I talk to either of you. And we've had the pleasure of interacting together professionally over the years, and look forward to continuing that. I would welcome anybody who's attending this. Feel free to reach out to me or Anna. We're always happy to spend some time on the phone with people and just help them think through ideas. Emmet, Andrew, I wouldn't gratuitously offer up your time, but I know you'd be happy to take some questions to the extent people have them. I know this is an area that you're really passionate about, and you enjoy sharing your thoughts on these topics, and just appreciate everything you guys are doing for the industry.
Of course.
Yeah,
I'll
Anna,
definitely,
thank you so much.
Yeah, and I'll say, definitely if anybody has questions, comments, thoughts on, kind of, what we're doing at ADSO as we continue to move forward on the advocacy side, industry partner side, always happy to connect and talk. So would love that.
Outstanding. Well, thank you very much for your time today, gentlemen, and thank you for everybody who attended. I know we had a great response to this, so look forward to continuing the conversation and hope you all have a great rest of the day.
Thanks, everyone.
Thank you.
Thank you all so much.
Bye.